Do you feel like your bones are getting weaker with age? Have you heard the term osteoporosis and wondered what it really means? Namaskar, I am Dr. Prasun Sanyal, consultant arthroplasty surgeon. Today, I will talk about osteoporosis and how it impacts your bones and what medications can help to manage it. Stay tuned because we will break it down in a simple language you can understand. So, what is osteoporosis? Osteoporosis is a condition when there is a decrease in the bone mineral strength or density and the bones become fragile, making them more prone to fracture even with a trivial fall. It is very common in the elderly individuals, especially the postmenopausal women after 50 years of age, but it can affect anyone. So, who are at risk? You might be at risk for osteoporosis if you are aged more than 50 years, especially in the postmenopausal females, family history of osteoporotic fractures, any history of malignancy, chronic renal disease, lifestyle, and on medications like steroids, diseases like rheumatoid arthritis, and if you don't take enough supplementation of calcium and vitamin D3. Now, what are the signs and symptoms of osteoporosis? In early stages, osteoporosis does not have any obvious signs until and unless the fracture happens. But there may be signs like brittle fingernails, reduced grip strength, muscle fatigue, reduced receding gum lines, and cervical pain or back pain. Now, if there is an osteoporotic fracture in the spine, there will be sudden back pain or loss of height, a hunched posture or a curved spine, which is known as kyphosis, and even trivial trauma can cause fractures, especially the distal radius fractures. So, how to diagnose it? Osteoporosis is diagnosed definitively with a DEXA scan, and we have to quantify the osteoporosis in the T-score. Additionally, we need to do the testing of the serum vitamin D levels, parathyroid levels, and other renal function parameters. So, how osteoporosis is treated? It is essentially treated medically with pharmacotherapy, and it can be effectively managed. The initial management is with bisphosphonates or calcitonin nasal spray, and lately with parathyroid injections. Calcium and vitamin D supplementations are also helpful. Apart from that, patient needs to do muscle strengthening exercise and light aerobic exercises. Adequate sunlight exposure is also important. Hormone replacement therapy is indicated for women after the menopause. There is a newer therapy with injectable preparations like denosumab. Lifestyle changes also play a major role, especially the exercise, as I mentioned, a healthy, balanced diet, and avoiding smoking and excessive alcohol consumption. Now, why you should require a doctor's advice if you have osteoporosis? Osteoporosis is a gradual process. Initially, there will be osteopenia and then it will proceed to osteoporosis. So, early diagnosis and treatment is essential to prevent any fracture which will be happening. So, if you are experiencing any symptoms like unexplained back pain or any history of recent fracture, don't wait. Schedule your visit with a orthopedic surgeon and get a bone density test done, because with the proper diagnosis you can treat the root cause. Don't wait until you break a bone. Start protecting your bones from today. If you found this video helpful, then like, share and subscribe for more information on health and wellness.